Good evening and thank you for joining us. The Thunder Bay Police Services Board will decide whether or not to establish an expert panel to provide advice for systemic and cultural changes to the police service.
This comes as the service is dealing with human rights complaints of harassment and discrimination against the board and senior leadership. The decision will happen at a special board meeting on Wednesday morning. The recommended expert panel would be led by a former chair of the Toronto Police Services Board, with other positions focusing on mental health and reconciliation. Local board chair Kristen Oliver praised the potential panel's experience, all of whom are based outside the city of Thunder Bay.
When we're looking at how we best facilitate that, we know that we need some expertise that is outside of what we have currently around our Police Services Board. In fact, I would think even probably within the city, we'd be really challenged to find a lot of that expertise that this expert panel is going to be bringing to the table. And, quite frankly, the people that will be sitting around that table have, strong governance experience.
But the police board is already getting some backlash for the potential panel. Chantel Bryson is the lawyer representing 11 people claiming harassment and discrimination against local police leadership. In a letter sent to Dougal Media, she said the review panel is a slap in the face to victims, families, police officers, civilian staff, and board member Georgianne Morisseau. Bryson went on to say this move is a deflection from the need for new police leadership in Thunder Bay.
Superior North EMS leadership is sounding the alarm after a record number of code blacks. Wait times for ambulance have been as long as 2 hours, as some paramedics are getting stuck at the hospital for more than 8 hours due to offloading issues at the regional. Staff isolating with COVID-19 has also played a role. All this and call volumes continue to go up. Corey Nordstrom has more.
The frequency of code blacks has grown to an alarming rate locally, more often than it ever has. In simple terms, the code is used when no ambulances are available to respond. Superior North EMS's Andrew Dillon says the situation is growing more dire by the day, with COVID-19 causing staffing shortages and an increase in call volume partially brought on by the opioid crisis, but the biggest impact is delays in offloading patients at the regional hospital.
Our offload delays are both increasing in time and in frequency. We generally are averaging somewhere in that hour and a half, give or take, for an offload delay, but we've seen them as high as 6 or 8 hours. 8 hours of an offload delay is 3/4 of our regular shift. Somebody's sitting with a given patient at the hospital, which means they can't be out responding to other 911 calls.
In efforts to address those lengthy offload delays, Superior North EMS is working with Thunder Bay's regional hospital on implementing a program called Fit to Sit. It's currently being done in Sudbury, and Dillon believes it could be only just a matter of weeks before it's put in place locally.
What that does is allow paramedics to triage and bring in lower acuity patients that aren't life-threatening, if you will, that have the ability to wait to see a doctor. It frees up our ambulances to get back out and respond to more emergency calls, and allows the physicians and nurses at the hospital to see the most appropriate higher acuity patients in their priority sequence.
Dillon knows that unfortunately the stresses on his workforce brought on by high rates of opioid use locally is not going away, and he expects it could still be a short while before their staffing levels can return to normal after COVID-19 loosens its grip on paramedics.
Looking at our numbers, we're at least a couple of weeks away from hopefully being out of the COVID concerns for our staff. At least a couple, 3 weeks, I would say.
Dillon stresses that anyone who needs urgent care from EMS will get it. Corey Nordstrom, TBC News.
One man is dead following a weekend house fire in Atikokan. It broke out around 8 o'clock Saturday morning, and a deceased adult male was found inside. The victim's name hasn't yet been released. Rainy River OPP are now investigating alongside the Ontario Fire Marshal and the Coroner's Office. Anyone with information is urged to contact police.
The Crown's key witness in the murder trial of Musab Zaboon and David Huey faced some tough cross-examination from the two defense lawyers today. Marshal Hardy Fox pleaded guilty last month to kidnapping an accessory after the fact in connection with the murder of Lee Kyoto in February of 2019. And he provided shocking testimony on Friday about the other two accused and how the murder was carried out. This was day 6 in the trial, which is scheduled to last 8 days. The lawyers for Zaboon and Huey pressured Hardy Fox on why his testimony Friday was different from his interview with city police when he first turned himself in. Hardy Fox was the driver of the vehicle the night the murder was carried out on Mission Island. Hardy Fox originally claimed he didn't know Huey's role in the killing and that he didn't hear what was said in the backseat of the car. Hardy Fox admitted he left out some details in 2019, but said he wants to help police in the Crown with their case so that Kyoto's family can know the truth and have some closure. Huey's lawyer also asked him why he didn't just drive away when he realized a murder was about to happen. Hardy Fox said he was scared for his safety and his family if he fled the scene. The trial continues tomorrow.
Disturbing details have come to light regarding a local case of child neglect. Thunder Bay Police found 6 young children unsupervised in a Southside home last week, including one who had injuries and may have been malnourished. The children are aged 8 months to 13 years old. The investigation led police to a nearby residence where a man was arrested after a brief struggle. A woman was also arrested, and they've both been charged with child abandonment and failure to provide the necessities of life.
Gas prices continue to soar around the globe, and Thunder Bay is no exception, with prices reaching record highs. Prices at the pump along Arthur Street today were as high as $1.95 at some stations, with others still in the mid-170s. And on the Fort William First Nation, prices are mainly in the mid-160s, and premium rates are all above $2. Drivers we spoke to were mostly resigned to the fact that high gas prices are an unfortunate but unavoidable cost. Others said they may have to rethink their driving habits in light of the high prices. One motorist, however, had a different perspective. Christine Radborn says paying more for gas is a way people here can support economic sanctions against Russia.
Listening this morning to NATO briefing, and NATO actually asked Prime Minister Trudeau directly if Canada was ready to step up with oil reserves in case they need to shut off the ones they're getting from Russia. And so I'd like to ask Alberta and Premier Kinney, are you ready? And hopefully you can help Europe and the rest of us out. So.
With analysts predicting that average gas prices in Ontario will exceed $2 a litre within the next week, local drivers are bracing for even more pain at the pump.
Turning to COVID-19, the Thunder Bay District Health Unit is reporting another death. 80 people have now died in the district since the pandemic began, and a new outbreak has been declared at St. Joseph's Hospital. It's contained to an area of the building known as 5 South in the Geriatric Assessment and Rehabilitative Care Program. There's some good news, however, at the regional hospital, where the number of positive patients has dipped below 30 for the first time in more than 6 weeks. There are now 29 COVID-positive patients being treated at the Regional Health Sciences Centre, the lowest number since January. However, the number of those patients in the ICU rose over the weekend from 7 to 9. The overall hospital occupancy rate sits at nearly 104%, while ICU occupancy has fallen below 82%. The Thunder Bay District Health Unit is reporting 123 new infections since Friday. The number of active cases has dropped to 172. It's the first time this year that number has dipped below 200. Over in the Northwestern Health Unit, there are now 205 active cases. 156 of those, or more than 75%, come from the Sioux Lookout Health Hub. The NWHU's test positivity rate has risen slightly to 24.3%. Ontario is giving eligible nurses $5,000 to help incentivize them to stay on the job. According to the government, the $763 million investment will help retain nurses across the health sector and stabilize the current nursing workforce in the province. But some healthcare advocates say the measure falls short. Colin DeMello explains.
Across Ontario's healthcare system, COVID-19 has contributed to a crisis in staffing, with an estimated 20 to 30,000 nurses having left the profession.
So many of them are burnt out. Some of them are injured because they are working without a partner, severely short-staffed in every single sector.
Unions say the shortage is having downstream impacts, risking the very care that patients receive.
ICUs, they do not have enough nurses for one-to-one care, not even one-to-two care. Emerge departments, they're overflowing with ambulances waiting to offload their patients, people in waiting rooms because they're operating at a 50% capacity of nurses.
The Ford government said today that Ontario's nursing workforce needs to be stabilized. And so thousands of nurses will receive a one-time $5,000 retention check. Half of it now, the other half in September, if they stick around.
A strong nursing workforce is going to be critical to supporting the province's recovery in the months and years ahead. Simply put, an investment in our nurses is an investment in our future.
But healthcare advocates are warning that the gesture might fall flat.
And when I talked to them and asked them, is this enough to bring you back? They said no. Like, they want to see the government develop and have a plan to implement a long-term, rational, smart health human resources plan.
The unions say part of that is repealing Bill 124, the government's legislation that was designed to hold public sector wages at 1%. $5,000, they say, just doesn't cut it.
It doesn't recognize the value of their work, the level of education that they have, the critical thinking skills that they put in and day out to take care of patients.
So far, the government hasn't shown a willingness to repeal that legislation.
Mayor Bill Morrow is asking his fellow councillors to pass his motion of support of Ukrainian refugees this evening. That includes lending a hand locally. In the mayor's motion, which would be forwarded to the Trudeau government, Morrow wants Ottawa to welcome those fleeing to Canada with open arms. He also wants Thunder Bay to be identified as an ideal location for refugee settlement. Our city has about 14,000 people with Ukrainian heritage, and the local Multicultural Association has been deemed a resettlement assistance program agency by the government. Morrow says Thunder Bay has the necessary supports available.
But ultimately, to pick a number, if Thunder Bay was fortunate enough to receive 500 or 1,000 or 50, whatever the number may be, ultimately, these individuals are going to need a range of supports, primarily being, when you think about housing.
Also this evening, City staff is asking for Council to support a funding application to Canada's Active Transportation Fund. It would cover 60% of the cost of two new multi-use bridges, one near the Lakehead University Fieldhouse and another between George Burke Park and River Terrace.
Lakehead University has launched its annual Research and Innovation Week. Planetary stewardship is the theme this year, and LU officials kicked off a week full of online presentations with a virtual opening ceremony today. Mitchell Ringos has the details.
Our annual Research and Innovation Week reminds us of the diversity of knowledge and of the many challenges our researchers overcome in their steady pursuit of solutions and progress.
The opening ceremonies for the 17th Annual Research and Innovation Week saw the team lead for the Climate Emergency Unit, Seth Kleen, speak about everything from the pandemic to past and current conflicts, all the way to the ever-growing global climate crisis. Kleen pointed out that for the last 20 years, Canada's greenhouse emissions have flatlined, and he thinks a major part of the problem was in the way we incentivize change.
Actions taken to date have been almost entirely voluntary. We encourage change. We incentivize change. We offer rebates. We send price signals. What we have decidedly not done is actually require change. If we're going to meet the GHG targets set out by the IPCC, we need to set clear near-term dates by which certain things will be required.
Lakehead also released their first Ignite video featuring a research project by Dr. Muntasi Bilda from Civil Engineering called Infrastructure Condition Assessment and Management During the COVID-19 Pandemic Using Artificial Intelligence.
We are developing an AI-based condition assessment tool using different types of images to classify the defect types for bridge systems to ensure enhanced resilience and robustness, and the ability to predict future conditions of our existing structures.
Research and Innovation Week will feature many virtual events from art tours, discussions, 2 more Ignite videos, and more, which can be found on the LU website. Mitchell Ringos, TBT News.
An electronic dance music DJ from Thunder Bay has been nominated for a Juno Award. Sydney Blue is up for Electronic Album of the Year. Blue left Thunder Bay after high school more than 20 years ago and has been involved in the dance music scene around the world. She moved back to the city during the pandemic to finish the last 3 or 4 songs on her new album called Conviction. The album is now one of the 5 nominees for the Juno Award in the electronic music category. The Junos will be held in Toronto on May 15th.
A Thunder Bay woman is now $250,000 richer after taking home the top prize in OLG's Instant Crossword Deluxe. Stephanie D'Angelo purchased her winning ticket at K&A Variety on the Fort William First Nation. The 64-year-old retiree says she'll share the prize money with her children. She also plans to do some traveling and donate to local charities.
The Township of Connie hosted a ribbon-cutting ceremony yesterday to officially open its new all-season pavilion. The structure was first opened to the public a year ago and has been used as an ice rink during the winter and a place to hold festivals and markets in the warmer months. The pavilion is the only covered rink in the Thunder Bay area. Comnie officials say they weren't able to have an official ceremony until now due to COVID restrictions. Mayor Kevin Holland says the community is very proud of the pavilion and people of all ages have been able to enjoy it. Along with the ribbon cutting, the event also featured a fire where residents could roast marshmallows and make s'mores or go tobogganing on a nearby sliding hill.
The rink itself has been getting used a ton this year. I work right across the road and I see the kids in the community out here every day. It's being used quite a lot. So we're happy to see that the investment is paying off.
I like the rink because it's fun to skate on. I can come here to skate with my friends and have fun outside.
You know, our community has a lot of pride in this rink. And so, yeah, it's just been great to have for the kids.
Well, Fiona, it was a mild week.